Hey everyone, my name is Michelle. This is Mitch of All Trades and welcome back to my channel. If you're new here, welcome, welcome, welcome. Thank you for joining the family. Thank you for subscribing and thank you for watching this video. I really appreciate it. If you're OD, a recurring member, I want to say welcome as well. Thank you for coming back. Thank you for believing in me and thank you for continuing to support me by watching my videos. So for those of you that don't know me, my name is Michelle. Like I mentioned before, I am a registered nurse and also a nurse practitioner student. This channel is mainly about my life as a nurse and just everything surrounding it because I'm just very, what's the word? I feel like I'm very multifaceted and there's just so many things around my life that also are attached to my nursing career. So with that being said, this video is in response to a question that I received in one of my comments asking about nursing interviews and just questions about getting acing nursing interviews. And I've actually gotten comments about people that are applying for jobs, especially when I talked about being an ICU nurse. I got lots of comments of people applying to be ICU nurses, getting their interviews done, or planning on getting into the ICU and all that stuff. So I think this is also a very good timely video that will help a lot of you guys. Hopefully it does. Now in this video I'm just going to be talking about tips on how to ace your interview as a nurse. I'm going to use my personal experience, but also I'm going to give advice from what I've heard from recruiters and also things that I've practiced that helped me. So as a nurse, I've only worked as a nurse in one hospital, but I've worked in 2 different units. So I've had to apply and get interviewed twice for a nursing position. So for me, the way that I normally get jobs or the way I get quick interviews is that I look at the institution or the company that I'm trying to work for and see if they have an open interview day. There are times that some hospitals, some corporations, they just have an open interview day where they accept multiple people and they interview them like a mass interview kind of thing, and most of the time they hire them. So that's something I always try to look for. But for the particular hospital that I'm working in now, I wasn't able to find that event. So I actually had to apply online and yada, yada, yada. So when I was getting into the trauma unit, I just simply applied there and I got an interview with them and that was that. For the ICU, however, it was kind of difficult. ICU is like a specialty unit, and it was like the floor that I actually wanted and the position I actually wanted was a very competitive position. So in that case, what helped me was who I knew. I knew this lady who was friends with the manager, and she was able to put a good word in for me. And I noticed that sometimes, especially in the hospital, sometimes when it comes to internal hiring, hiring internally, it's all about connections and who you know and who can speak on your behalf, which sucks, but that's the reality of what I've seen so far. So with that being said, that's how I got an interview to work in the ICU. Now, when it comes to interview questions, before I used to practice, and I guess I didn't practice properly. It is important that you prep for your interviews. Very important, because the last thing you want is for them to ask you a question and you have to dig down memory lane just to get that answer, because then it looks like you don't know, you did not come prepared. My first tip is, before anything, is to have an actual passion for whatever it is you're applying for. I'm not a good liar. I've been told multiple times, and I just know it at this point. So I know that if I am faking passion for something, I'm sure that it can be easily noticed. I can't speak for anyone else, but I know for me, the way that I get by getting interviews is to apply for something that I'm passionate about. Because when they ask me questions like, why do I want to work in this unit, the passion can be felt and seen in my answer. Speaking of that question, it is important that you have a good reason as to why you want to work in the unit that you're applying for. You can use this time to mention your education, background experiences, maybe volunteering or whatever experience you've had is similar to the position that you're applying for. And you can also, talk about like your, I guess, whatever skills that you have and how it can contribute to the unit. I wouldn't advise talking about future like goals if it pertains to leaving that unit in a few years, because I know us young nurses, like, we try to get into these nursing positions just for the experience so we can leave, and a lot of recruiters, they know that. So the last thing you want is to give them an idea that that's your plan. Another tip is to always smile at interviews. Always smile. I've learned to just keep my mouth smiling, fake laugh, like just smile, smile, smile. It's warm and welcoming. Also remember that you getting hired into a place is dependent on one person, or maybe a couple people that are in the room, depending on who's interviewing you, but it's dependent on how they feel about you, whatever persona that you give them, whatever energy you kind of give them. So it's important that you maintain a warm like energy when you walk into the room. Your smile is warm, your whole like demeanor is warm. My third tip is to prepare answers in advance. So answers, most of the time, like, because besides nursing, I've like applied for different jobs, whether it was a CNA, a tech. I worked at Costco once. I worked in, I guess in school, I applied for different positions as an orientation leader. So I've done interviews in a while, often. And the way each interview goes down is they ask you, tell me about yourself. They ask you why you want to work for this position. And then they go on to ask you scenario questions. So over the years, what I've learned is that the way I prep for interviews, I just think about a leadership position that I've had in a while. It could be like in college, I was an orientation leader, or maybe at my church, I was like head of the content creating team, or maybe in school, I was head of like what was I in school? Pinning ceremony chair. I was part of the Student Nurses Association at school, and I did a lot of leadership things at school. So I looked at the one that has like a lot of more experience and a lot more stories to tell, maybe a lot more that was required of me in that leadership position. And I just think about my experiences so that whatever question they ask me, I can always have a scenario to give them. As a leader, it is very likely that you have experiences that can answer questions that you'll be asked at interviews. Experiences with conflict resolution, experiences with multitasking, experiences with like dealing with an ethical dilemma, experiences with making a mistake and showing weaknesses. Like, you're gonna have those experiences sometime in your life. So if you find a leadership position that you've done before, it just helps. So at least you have a story to tell, and it makes it easier. So you're not like lost or just mute on that specific moment. If you haven't been doing much leadership in your past, you can look in your family, like what role do you play in your family? I'm an older sibling. I can just use my role as an older sibling and just like, maybe not really exaggerate, but just like put a little more emphasis on it and use that to answer my questions. But those are the 3 tips that I have for you guys. I hope that helped. If you need more, you can look up other videos on nursing tips interviews, but I think this is pretty much what's helped me so far. I don't really do too much. Not saying there's any much Another tip, make sure you have a question to ask them. It just shows that you're interested in what they're saying. So at the end of each interview, they're going to ask you if you have any questions. Make sure you find a question to ask them. Questions that I've started to ask are stuff like, oh, what's a typical day like in the unit? Or what is expected of me? What skills are expected of me? That's pretty much what I ask. Those 2 questions, like what's expected of me coming into this unit, or what's a typical day look like? If there's anything like that I'm actually curious about, I do ask that as well. But always try to find a question. It just shows professionalism, and it shows that you really care about the position you're applying for. And I hope this helped anyone that's watching this video. If you watched this video before you took your interview, I pray that you get your interview, you get that job, and yeah. But thank you so much for watching. Make sure you like this video, make sure you comment your thoughts, comment questions, make sure you follow me on social media, on Instagram. Make sure you subscribe to this channel, okay? I am here to stay, so you don't want to miss out on anything that I put up on this channel, okay? And thank you so much, and I'll see you later. Bye.